डॉक्टर शॉन बेकर एक मशहूर ऑर्थोपेडिक सर्जन है जो कार्निवोर डाइट के एक शरपसंद हिमायती हैं।
He is the CEO of Meat Treatment, MeatRx. He's authored the influential bestseller book, The Carnivore Diet.
My own health to start with, as many physicians that come to this sort of discover. For every medical condition you can name, I think nutrition will impact that, you know.
वो आए अपनी सर्जरी करवाने के लिए, उनकी इन्फ्लेमेशन इतनी कम हो चुकी हुई थी कि उनको सर्जरी करने की ज़रूरत नहीं पड़ रही, और उन्होंने बताया कि ज़रूरी है कि आप अपने मसल को हाइड्रेट रखें, उसको प्री हाइड्रेशन भी दें। अस्सलामुअलैकुम, खुशामदीद। मैं डॉक्टर आमिर खान क्लिनिक्स में एक ऐसा इल्मी सफ़र जहां हम बात करते हैं जिस्मानी और जहनी सेहत के उन पहलुओं पर जिन्हें समझना आज के दौर में सबसे ज्यादा जरूरी है।
और मैं हूँ रानी चैट जीपीटी, आपकी को होस्ट। यहाँ हम आपकी मुलाकात करवाते हैं दुनिया के मारूफ डॉक्टरों, साइंसदानों, मुसन्निफीन और रिसर्चर्स से।
हम गुफ्तगू करते हैं उन किताबों पर जिन्होंने सोचने का अंदाज बदला, उन तहकीकी मकामों पर जो सच्चाई के करीब ले गए, और उन साइंसी शवाहद पर जो आज की सेहत का कल बन रहे हैं।
ये सिर्फ एक पॉडकास्ट नहीं बल्कि एक मिशन है, आपको बाखबर बनाना, ताकत देना और सही फैसला करने में मदद करना।
तो जुड़िए हमारे साथ हर हफ्ते खान क्लिनिक्स पर, जहां सच्चाई, तहकीक और तजर्बा एक साथ आते हैं आपकी सेहत की बेहतरी के लिए। ये है खान क्लिनिक्स, सेहत, शऊर और सच्चाई का संगम। हम मोटापे, ओबेसिटी, डायबिटीज, कुव्वत मदाफत के मसाइल और मुसलसल थकावट यानी क्रोनिक फटीग में एक खतरनाक इजाफा देख रहे हैं, जो एक वाज़ेह और बुनियादी तब्दीली की जरूरत की निशानदही कर रहा है। एक हकीकी मेटाबॉलिक इनकलाब। रिस्ट्रिक्टिव डाइट वाली ग़िज़ाओं और आर्जी रुझानात के ना ख़त्म होने वाले चक्कर को भूल जाएं। अब वक्त आ गया है कि ऐसी आवाज़ सामने आए जो अनवेवरिंग क्लैरिटी यानी मुकम्मल वजाहत के साथ शो को चीर दे और हकीकी ठोस नताइज फ्राहम करे। जदीद तहकीकात और हालिया मुताला से पता चलता है कि कीटोजेनिक डाइट, कार्निवोरस डाइट या और ऐसी कई डाइटें आंतड़ियों और दूसरी एरियाज को, उनकी इन्फ्लेमेशन यानी उनकी सोजिश को कम करती हैं। 2021 की हार्वर्ड कार्निवोरस डाइट स्टडी जो करंट डेवलपमेंट इन न्यूट्रिशन में शाया हुई है, उसके सर्वे से पता चलता है कि पार्टिसिपेंट में एक अहम बिलतरतीब 85% और 83% ने इस ग़िज़ा को अपनाने के बाद ज़हनी वजाहत और तवज्जो में बेहतरी की इतला दी। खान क्लिनिक्स के एक शो के साथ हम ये एक एनलाइटनिंग एपिसोड में आपकी खिदमत में हाजिर हैं। मैं डॉक्टर आमिर खान, और आज हम जदीद सेहत के देखभाल में सबसे ज़्यादा फिक्र अंगेज गुफ्तगू में डाइव इन करेंगे। हमारे साथ डॉक्टर शॉन बेकर शामिल हैं। He is the CEO of Meat Treatment, MeatRx. He's authored the influential bestseller book, The Carnivore Diet, which serves as a comprehensive guide to his lifestyle. He's a world champion athlete, chief medical officer of Rivero, which provides personalized care for metabolic and autoimmune conditions. Shawn earned his medical degree from Texas Tech University and completed his residency at the University of Texas at Rani, अस्सलाम वालेकुम, और आपको भी वेलकम शो में आने का।
वाह अलैकुम अस्सलाम डॉक्टर खान, बहुत शुक्रिया। मैं यहाँ हूँ और तैयार हूँ आपकी हर बात को सुनने और जवाब देने के लिए। चलिए शो शुरू करते हैं और अपने नाजरीन को एक एनलाइटनिंग और मालूमाती गुफ्तगू सुनाते हैं।
रानी, सबसे पहले तो अपने आज के गेस्ट यानी शॉन बेकर का तारफ करवाएं हमें।
जी डॉक्टर खान, डॉक्टर शॉन बेकर एक मशहूर ऑर्थोपेडिक सर्जन है जो कार्निवोर डाइट के एक शरपसंद हिमायती हैं। उनका मानना है कि सिर्फ गोश्त पर मबनी ग़िज़ा से ना सिर्फ मेटाबॉलिक हेल्थ बेहतर होती है, बल्कि डायबिटीज, ओबेसिटी और क्रॉनिक फटीग जैसी बीमारियों में भी काफी बेहतरी आ सकती है। डॉक्टर बेकर ने अपनी किताब द कार्निवोर डाइट में अपने तजुर्बे और रिसर्च का वाज़ेह तौर पर जिक्र किया है, और वो अपने सोशल मीडिया प्लेटफॉर्म्स पर भी इस डाइट के हवाले से मशवरा देते रहते हैं। उनका अप्रोच मुख्तलिफ लेकिन काफी लोगों के लिए फायदेमंद साबित हुआ है, और वो इस हवाले से काफी मुतासिर कौन साबित हुए हैं।
सो आप देखें डॉक्टर शॉन बेकर जिनके तकरीबन 3.5 लाख फॉलोअर्स हैं यूट्यूब में। कार्निवोरस डाइट में उन्होंने उन अपने पहले सवाल के जवाब में कैसे बताया कि अपने अर्ली 40s में जब वो डॉक्टर थे, वो एज कर रहे थे और उनको एहसास हुआ कि मुझे अपनी डाइट अब तब्दील करनी चाहिए, और उस वक्त उन्होंने कार्निवोरस डाइट को अपनाया। शॉन, लेट्स डाइव राइट इनटू द फर्स्ट क्वेश्चन and touch on what inspired you to go on to this journey, and how did you become an advocate for the carnivore diet?
Yeah, well, first of all, it was about my own health to start with, as many physicians that come to this sort of discover. I was in my sort of early 40s, and my health wasn't where it should have been. Even though I was an athlete and physician, you think you would be immune from the effects of age and disease as a physician, which you're clearly not. So I started to heavily look into nutrition, and started experimenting with several different strategies. And just coincidentally, at the time, as an orthopedic surgeon, we were operating on a lot of patients that struggle with obesity. And as you probably are aware, just like any other specialty, obesity complicates the results. There's higher rates of complications in obese patients when you perform surgery on them, higher risk for things like blood clots, infections, poor rehab potential and outcomes. And so, as a community of surgeons, we had together decided that we were going to try to help our patients to lose weight prior to taking them to the operating room. No real strategy was given. It was kind of left to our own devices to figure out how to get your patients to lose weight. And so at that time, I was doing a low carb diet myself, and I was advocating that for my patients. And not all the patients would do it. Some would not. Certainly some would say, I don't want to change the way I eat. And interestingly, the ones that would change their diet to these very low carb diets, not often would they. I mean, it turned out that many of them came back to me reporting that the symptoms in their knee had minimized dramatically or sometimes completely resolved, even though I had them on the operating room scheduled for a knee replacement. So that was sort of intriguing to me. I was like, well, if your knee does not hurt, that's the primary indication for the surgery. So I can't justify an operation if you're no longer in pain. If you're willing to continue this lifestyle and this diet, then you can probably avoid or at least delay significantly your surgery. And so that was really the first spark that got me interested in this. I mean, certainly, you think about diet and weight loss and to some degree diabetes, but you're not thinking about it in terms of a lot of other conditions, which, as you probably are aware now, nutrition impacts dramatically. Mental health, as you talked about in your intro, arthritis, and from my perspective, things like rheumatoid arthritis, psoriatic arthritis, of course, osteoarthritis, a whole gamut of autoimmune diseases seem to respond to this. So this has got me interested in doing this. And so the more I delved into the fact that lifestyle had such a powerful impact, stuff that I didn't really learn in medical school. This was something that was sort of glossed over, wasn't really emphasized, and it certainly isn't incentivized in any significant way. In ways, it's kind of de-incentivized, to be honest. And so I was kind of a little frustrated with that. And so I, just kind of stepped away from, the clinical practice, which I had trained in. It was kind of a tough decision. But ultimately, I feel like I'm ultimately making a bigger difference for more patients in a more holistic way, which has really been life altering for these people in a very good way. And so that's what kind of led me to this. And I was in this low carb sort of, environment. And I came across these people that were just consuming basically just meat. And I thought that was insane. I thought this just makes no sense. Fiber, vegetables, phytonutrients, vitamin C, all these things that were obviously things that would be on my mind and anyone else's mind. But as I delved into it farther and farther and saw the just tremendous potential as a therapy, that this really excited me. And so I've been pursuing this now for almost a decade now, just in my own personal life. And then as far as interacting now with thousands upon thousands of patients that have literally changed their lives, for the better. And I think it's a great intervention. It's a therapeutic tool. It's 3 months, 6 months for most people. Some people will do it a little bit longer. Some people will do it indefinitely, which I think is, and it's controversial, but I think there's certainly people that are examples of that. So it's an interesting thing because, and I don't necessarily want to call something a panacea, but I mean, the number of conditions, and I would just say nutrition in general, I would be so bold as to say that for every medical condition you can name, I think nutrition will impact that, in either good or bad. And I think that, I've seen things that are like genetic disorders, things like Ehlers-Danlos syndrome, which is just, it's a genetic connective tissue disorder. People,
Sure.
They dislocate their joint spontaneously. They go on a diet and their joints stop dislocating, which still mystifies me as to why that works. I don't know why. I can't figure out mechanistically what's going on yet, but it just does. And fortunately, we're now seeing greater and greater interest in this. There's finally a little bit of funding to fund some studies. So we've got a few studies already that have been accomplished. We've got more in the works. And but as you mentioned, on the mental health side, which is a huge problem, here in the United States, it's something, some estimates would say one out of every 4 people has some sort of mental health disorder. That's a lot of people, and diet clearly impacts that. I know that's almost controversial to say, but it really seems to.
उन्होंने बताया कि ना सिर्फ ये कि मैंने खुद अपनी डाइट को चेंज किया, बल्कि मेरे साथ जो पेशेंट्स थे, मैं उनको भी इसके बारे में मशवरा देने लगा कि वो कार्निवरस डाइट को अपनाएं। उन्होंने अपनी स्टोरी बताई कि कई पेशेंट्स मैंने स्केड्यूल किए और बाय द टाइम वो आए अपनी सर्जरी करवाने के लिए, उनकी इन्फ्लेमेशन इतनी कम हो चुकी हुई थी कि उनको सर्जरी करने की ज़रूरत नहीं पड़ रही थी। तो फिर उन्होंने कहा कि मैं इनको ऑपरेट नहीं कर सकता, मैं इनकी सर्जरी कैंसिल कर रहा हूं और उनको इस चेंज यानी कि डाइट, कार्निवरस डाइट अपनाने में उनको गाइड करूंगा। रानी, पहले ये तो उनके पहले सवाल का जवाब था। रानी, आप हमें बताएं कार्निवरस डाइट में हमारे नाजरीन को बताएं कि ये कौन सी डाइट है, ये दूसरी डाइटों से किस तरह डिफरेंट है और इसमें क्या-क्या चीजें अडैप्ट करते हैं।
जी डॉक्टर खान, डॉक्टर शॉन बेकर एक मशहूर ऑर्थोपेडिक सर्जन है जो कार्निवोर डाइट के एक शरपसंद हिमायती हैं। उनका मानना है कि सिर्फ गोश्त पर मबनी ग़िज़ा से ना सिर्फ मेटाबॉलिक हेल्थ बेहतर होती है, बल्कि डायबिटीज, ओबेसिटी और क्रॉनिक फटीग जैसी बीमारियों में भी काफी बेहतरी आ सकती है। डॉक्टर बेकर ने अपनी किताब द कार्निवोर डाइट में अपने तजुर्बे और रिसर्च का वाज़ेह तौर पर जिक्र किया है और वो अपने सोशल मीडिया प्लेटफॉर्म्स पर भी इस डाइट के हवाले से मशवरा देते रहते हैं।
ओके, थैंक यू रानी, थैंक यू। चलिए, आपने जब हमें बताया, जो डॉक्टर बेकर आए आगे से उनके अगले सवाल का जवाब सुनते हैं, जहां पे उन्होंने अपनी जिंदगी में इस डाइट को क्यों अपनाया। Sean, tell us, what does your personal diet compose of when you're on a carnivore diet? Is it really strict meat only, and that's what you're approaching, or is there do you additionally balance out, or do you add supplements, or how do you go about planning your diet? And then we'll go on to the other effects of the diet in general, metabolic, mental, and all that. We'll discuss that. But how do you balance out your diet? You work, you're an athlete, you were world champion before, you've got a busy lifestyle. You want to make sure that your diet is supporting you and giving you all the nutrition and minusing away all the fatigue and stuff.
Yeah. So my personal diet, over the last, I've been doing this for about 9 years now. I consume quite a bit of meat. It's probably 95% of what I consume is meat, and mostly red meat, to be honest. I sometimes will have some fish. Sometimes I have some eggs. Occasionally I have some dairy products. And then every once in a great while, I'll have something that's, not at all carnivore, maybe a piece of fruit or something like that. But that's pretty unusual for me. I generally eat about twice a day because, again, the food that I consume is one, it's incredibly satiating. Number two, it's very slowly digested and broken down. So I have this steady stream of energy throughout the day, which, again, it frees me up, gives me a lot of time because I'm not spending much time eating. I'm literally probably spending 20 minutes a day in total consuming food, which is, contrast to the average person who might consume 4, 5, 6, 7 meals a day, small meals and snacks a day. So food is very much, even though it's kind of interesting, food is a very important part of my life because I talk about it all the time. But in my daily life, it's a very small part because I'm only spending a minimal amount of time actually preparing, eating, and dealing with food. I don't really have much struggle planning with. Like, for instance, today I had um, I had a little bit of cottage cheese and I had a couple steaks, and that will be probably the bulk of what I eat today. Just for reference, I'm 6'5", I'm 250 pounds. I'm a pretty big guy. I got, I went and ran some sprints over my lunch hour. This is so I stay active on a daily basis, and probably I'm consuming, if I had to guess, around 3,000 calories a day, which is not that much given the size and the activity level that I have. And it's quite easy to, it's easy to plan, it's easy to stay on, and it's very much, it surprisingly keeps me full. This is the interesting thing about me. I've always been a really big person. When I was competing as a competitive power lifter, when I had some, national records in that, it was not unusual for me to consume 7,000, 8,000 calories a day, eating constantly and constantly being hungry. Now, and this is a thing that I found that when I first went on a low carb ketogenic diet, the first time in my life, I wasn't hungry. I had this weird sensation of like, I'm not actually hungry right now. And that was very freeing in itself. And this is one of the things a lot of people will say about, on the surface, a carnivore diet seems very restrictive because you're not eating breads and pastas and fruits and vegetables and other, quote unquote healthy foods or junk food. But at the end of the day, it becomes very liberating because you just don't want those things, which is something a lot of people can't wrap their mind around, saying, you know what, I don't really want the chocolate cake. I don't really want the bread. I don't want the pizza, the pasta. I'm very happy with what I have and I thoroughly enjoy my diet. It's something that I look forward to every meal. I never get disappointed. And all before I got to eat or eat something, the meal would be, I give it a C plus, or you're let down quite often. At least this is consistent at this point. I'm very good at making steaks at this point, having made thousands of them over the years, so I know how to cook for myself. So that's easy.
तो नाजरीन, आपने सुना डॉक्टर बेबकर ने कहा है कि मैं 6 फुट 5 इंच का आदमी हूं, मेरा वजन 250 पाउंड है, मैं पावर लिफ्टर चैंपियन भी हूं और रोइंग चैंपियन भी हूं अमेरिका में। और डॉक्टर शॉन बेकर जो है वो कार्निवोर डाइट रोज इस्तेमाल करते हैं। उन्होंने कहा है कि मेरी डाइट में मीट, गोश्त यानी 90% से ज़्यादा होता है और मैं उसके अलावा थोड़ा डेयरी प्रोडक्ट, लेकिन मैं न्यूट्रिशनल सप्लीमेंट नहीं लेता और अपनी ग़िज़ा से मैंने कंप्लीट कार्बोहाइड्रेट्स को रिमूव कर दिया है। कार्ब्स, रानी हमें बताएं हमारे नाजरीन को मुख्तसरन कि कार्ब्स का क्या रोल है और डॉक्टर शॉन बेकर ने उसको क्यों रिमूव किया और उसके क्या फ़ायदे हैं उसको रिमूव करने में।
कार्निवोर डाइट के फायदे में बेहतरीन वेट मैनेजमेंट, इंप्रूव्ड मेंटल क्लैरिटी, इन्फ्लेमेशन में कमी और एनर्जी लेवल्स में इजाफा शामिल है। सिर्फ मीट पर फोकस करने से लोगों को एक सिंपल और न्यूट्रिएंट डेंस डाइट मिलती है जो उनकी ओवरऑल हेल्थ को सपोर्ट कर सकती है।
रानी, उनके चौथे और पांचवें छठे सवाल का जवाब दे। पांचवें सवाल का जवाब ये था, या छठे सवाल का जवाब, कि मेंटल हेल्थ में कैसे क्लैरिटी आती है कार्निवोरस डाइट यूज करने से। John, follow-up question would be something on mental health. And generally there is some myth around the carnivore diet is that we're living in an era, again, where there is more anxiety, more depression. The roles that this diet was used several hundred or thousand years ago is now different. What would you say to the audience about mental health? Those who have mental health issue, is this that they need to be concerned about, or should how can it make this better, or does it have any role to play?
I think it definitely has a role to play. I think nutrition is a fundamental piece in the treatment of mental health. It may not be the only piece, but I think it is a critical piece. Right now, there is a whole bunch of literature that's come out, particularly on ketogenic diets, of which this would fall into that in regards to treating things like anxiety, depression, bipolar disorder, schizophrenia, schizoaffective disorder. I've seen it impact PTSD. I've seen it help people with ADHD. I've seen even people with autism improve some of their symptoms. So I think that mental health is probably one of the more common things that I see treated. And I do think that in a way, we have to realize our brain is an organ just like any other organ in our body, our heart, our lungs, our liver, our kidneys, our skin. It's all impacted by our nutrition. Our brain is not sheltered. Even though there's a blood-brain barrier, still nutrition gets through and it impacts it. I see when people have very erratic energy supplies, that is, very labile glucose, that we see that often in their mood, their emotional lability is all over the place. And so a lot of people, what they notice is once they adjust to the diet and they have this more steady source of energy, their mood often evens out, and they have this sort of calm happiness. It's like they're just kind of more laid back, chilled out. And when bad things occur and stress occurs, and it will, that's part of life. We're always going to be confronted with
Sure.
troubles and problems. They're able to handle it better. They're able to just kind of roll with the punches a little better. So I think nutrition is incredibly critical. I mean, there was a study out of Stanford a few years ago looking at like serum carnitine levels, and carnitine is something that you obtain primarily from meat. It's you really can't get that from plants to any significant degree. And patients with relatively low carnitine levels, now this is endogenously produced, we produce our own, but we can only produce a small amount. People that have low levels tend to have a much higher rate of major depressive disorder. And so when you bring the carnitine levels up, depression gets better. And I think there's a whole host of things, whether it's iron or zinc or even just inflammation. We have this, I mean, one of the common theoretical starting points for disease is this so-called inflamed gut, or gut hyperpermeability. Some people call it a leaky gut. That has some pretty significant correlations with a number of downstream effects, to include autoimmune disease. There's some great work out of Boston's Children's by a guy named Alessio Faisano, who's published a number of papers on this direct relationship between autoimmunity and gut health. And I think it holds up because I see it clinically. When you fix the gut, the autoimmune diseases go. And I think it also impacts our brain as well. So I think it's multifactorial. I think nutrition probably plays several roles, probably many of them which we haven't been able to identify yet. But yeah, it's one of the most underappreciated and overlooked things. But fortunately, there is this whole emerging field called metabolic psychiatry, where people are starting to treat these psychiatric conditions and conduct studies looking at shifting their metabolic health in a more favorable direction. And to me, it's a shame that you see, if you go to any sort of inpatient psychiatric center, whether it's for acute care or maybe say things like drug and alcohol or rehab, they often feed the patients these horrible junk food diets, and it's just not beneficial for them. I mean, hospital food in general is probably substandard. If you go there and try to order it, they're getting all these sugary filled foods and then we're chasing it with a insulin sliding scale, and it's just kind of like, seems.
और किस तरह से depression, anxiety, autism, Alzheimer और PTSD में फायदा होता है? अच्छा, अगले सवाल का जवाब सुनते हैं, जिसमें डॉक्टर बेकर ने एथलेटिक्स की गाइडेंस के बारे में बताया है. There is an athlete who wants to ask you specifically a question, and that's on his performance, and he wants to really know, if I'm on a carnivore diet, I feel like I need to take supplements. I need at times to boost my energy. And how do I just go about eating, get that boost of energy? Do I just go about eating more meat, more products along? And I'm just not a really good meat lover. So
well, yeah, I mean, it's hard. It's hard if you don't like the food, but I mean, just if you look at the physiology, I mean, what we're finding out is that it's less about muscle glycogen and more about actual blood glucose, which predicts drop-offs in performance. And so a couple tricks I'll tell you as someone who's competed as an athlete and been doing this very successfully as a carnivore. Some of the tricks I use is one, as we know, hydrated muscles perform better. And as we talked about earlier, when you're on a low carb state, we often tend to be relatively dehydrated. And so often what I will do is I will consume a liter or more of water. Like this little water bottle I have here is 48 ounces. I fill it with water and electrolyte. I will drink that, in and around workouts, just so that I maintain good hydration within the muscle. The muscle fibers just fire better. They contract harder, and you perform better when you're well hydrated. So I will tell somebody, 30 minutes before you're going to work out, drink a bunch of liquid, add some electrolytes to it. The other thing is when I mentioned about blood glucose. So we know that when you consume carbohydrates, particularly simple carbohydrates, it's very rapidly absorbed. You get a pretty reliable, quick glucose increase, which will help your performance out. However, you will see somewhat of the same thing around meat. However, it's a much delayed response. And so if you were to wear a CGM, a continuous glucose monitor, and watch your glucose, half an hour, 2 hours after the meal, it's going to be pretty flat. But 3-4 hours later, you're going to start to see that gradual increase in glucose. And that's going to correspond with, there's this gastric residence time. There's a time that the food sits in your stomach before it breaks down and goes into your small intestine. It's around 3 to 4 hours for most people, depending on the size of the meal and the exact content of that. And so you'll see that glucose surge, relative surge, I guess, a couple hours later. So you might want to time your meals or your workouts and your meals to that way. Like, for instance, back in 2019, I won the World Championships in rowing. And I literally had a 3-pound steak 4 hours before I competed, because I knew that was going to give me the best chance to have the energy available to me when I needed it. And so you can play with the timing of the meals. You can make sure you're hydrated. Obviously, you've got to eat adequately. For those people that have to be on a carnivore diet for whatever medical reason, again, this is something that I, as a physician, I talk to people about, is there a therapeutic need for this? If there's not, then you can play with carbohydrates. You might want to find your minimum effective dose of carbohydrates. So instead of, consuming 300, 400, 500 grams a night before, you might find that, in the peri-workout time, maybe 10 grams is enough to get you just that little bit of a blood glucose bounce so that you perform at a better level. So those are some things you can play with or consider and experiment with and see how it treats you.
तो नाज़रीन, आपने सुना कि किस तरह से डॉक्टर बेकर ने बताया कि इवन अगर आप मीट लवर्स हैं तो आप एज एन एथलीट आपकी परफॉर्मेंस किस तरह एनहांस होती है। और उन्होंने बताया कि ज़रूरी है कि आप अपने मसल को हाइड्रेट रखें, उसको प्री हाइड्रेशन भी दें, एक्सरसाइज के बाद भी हाइड्रेट रखें, और मीट इस्तेमाल करने से आपको किस तरह अर्ली सैटिस्फैक्शन यानी आपको भूख कम लगती है, ये एक बड़ा इंपॉर्टेंट कंपोनेंट उन्होंने बताया है। और कंपेयर किया इसको जीएलपी मेडिकेशंस के साथ। जीएलपी मेडिकेशंस वो मेडिकेशंस, फॉर एग्जांपल ओज़ेम्पिक और ट्रिपेज़ाइड, जो अभी मंजोरो यहाँ पे यूएस में काफ़ी ज़्यादा यूज़ हो रही हैं, उसका बुनियादी फंक्शन यही है कि आपकी गट की मोटिलिटी को स्लो करते हैं, हाजमे को कम करते हैं, और उस तरह से आपको भूख कम यानी अर्ली सैटिस्फैक्शन यानी भूख अर्ली सैटिस्फैक्शन आपको हो जाती है इससे। उन्होंने ये भी बताया कि एथलेटिक्स के अलावा मीट के सोर्स के बारे में भी उन्होंने वजाहत दी। तो आइए नाज़रीन सुनते हैं उन्होंने क्या मीट के बारे में बताया कि इसका सोर्स कहाँ से होगा। I have a follow-up, another question which is similar to concerns about the meat, the source of meat. This one specifically is like, I live in a city, I'm concerned about inorganic products have been added, artificial feeding, and meat and source. Could you ask Shawn what would be what would he suggest in terms of the meat products availability, and is there any specific type that he prefers over others, and his thoughts on this?
Yeah, that's a great question. And this is a really good question, and I've asked this question of literally thousands of people on this diet because it's important to figure this out. I've had researchers, like when Harvard did their study on this carnivore diet in 2021, they asked the exact same question. Do you have to have grass finished, organic meat or can regular meat from the supermarket work? And the outcomes were equivalent. There was no real difference in clinical outcomes. Now, are there nutritional differences? Sure, there are some differences. But to be honest, there's differences depending on the breed of cattle, the age of the cattle, where it was raised, how it was finished, the sex of the cattle. All these things will play a role on there. So as much as I would like to say you should only eat organic meat and it has to be regeneratively raised because it's better for the environment, the reality is from a clinical standpoint, there doesn't seem to be a difference in outcomes that anyone has shown so far. And I have not seen it myself. Now, what I will tell people is, hey, if you can support a local rancher, that's better. It's just better for the system in general, because we are at risk of a lot of these things going away. And I know with your audience, a lot of people might be concerned about halal meat, and it's fine. I mean, that works just as well as any other type. I know, like my wife's family is from Algeria, and so they'll eat halal. And I go to Costco Business Center sells all this wonderful halal meat. If you guys are looking for some, it's a great place to get it. Sell it in bulk, and yeah, it's fine. So it doesn't really matter that much. I think the biggest thing is you have to enjoy it. You have to enjoy the taste, because any diet in which you don't enjoy what you eat, or if you're constantly hungry, you're going to fail. You've got to find a way to make what you're eating enjoyable. So that's probably the biggest real concern that most people have.
तो आपने सुना कि उन्होंने डॉक्टर बेकर ने बताया कि कार्निवर्स डाइट के लिए मीट का इंतखाब करना काफ़ी ज़रूरत है. उन्होंने बताया कि ऑर्गेनिक मीट के लिए ग्रास फेड मीट की जो स्टडीज़ की गई हैं उसके मुताबिक ग्रास फेड मीट और नॉन ग्रास फेड मीट यानी कि नेचुरल मीट और जो मीट फार्म्स में ग्रो होता है उसमें कोई फ़र्क नहीं उन्होंने पाया. हाउएवर ये स्टडी ज़्यादा यूरोपियन स्टडीज़ हैं, ये थर्ड वर्ल्ड कंट्री डेवलपिंग कंट्री में नहीं की गई, तो इसके जो है वो असरात आपको अपने इलाके के मुताबिक देखने पड़ेंगे. उन्होंने ये भी बताया कि आपको अपने मीट को एंजॉय करना चाहिए. यहाँ पे अब वेस्ट में काफ़ी जगहों पे हलाल मीट इवन कॉस्को वगैरह में अवेलेबल है, और ये जो मीट है आप किसी भी तरह से आप घर पे खुद इसको तैयार करें और उसके मील्स प्रेप करना, उन्होंने बताया कि ये भी बड़ा इंपॉर्टेंट कंपोनेंट है. डॉक्टर बेकर ने और ये भी बताया कि अल्ट्रा प्रोसेस्ड मीट्स और प्रोडक्ट्स जो मार्केट में अवेलेबल हैं उनको बिल्कुल इस्तेमाल ना करें. रानी, हमें बताएं अल्ट्रा प्रोसेस्ड फूड कौन कौन सी हैं और इनको क्यों नहीं इस्तेमाल करना चाहिए.
अल्ट्रा प्रोसेस्ड फूड्स जैसे कि हॉट डॉग्स, सॉसेजेस, पैकेज्ड स्नैक्स और रेडी टू ईट मील्स में केमिकल्स, प्रिजर्वेटिव्स और अनहेल्दी फैट्स ज्यादा होते हैं. इनका इस्तेमाल कम करना इसलिए बेहतर होता है क्योंकि ये इन्फ्लेमेशन, वेट गेन और मेटाबॉलिक इश्यूज को बढ़ा सकते हैं. नेचुरल और मिनिमली प्रोसेस्ड फूड्स पर फोकस करने से हेल्थ बेहतर रहती है और न्यूट्रिएंट्स भी प्योर फॉर्म में मिलते हैं.
ठीक है, तो नाज़रीन आपने सुना कि डॉक्टर बेकर की गुफ्तगू आज. डॉक्टर बेकर कार्निवर्स डाइट के साथ काफ़ी ज़्यादा हामी हैं और उन्होंने बताया कि इस डाइट को अपनाने से आपकी बॉडी की सोजिश बहुत ज़्यादा कम हो जाती है, आपके बहुत ज़्यादा फ़ायदे उन्होंने बताया. और आपने रानी के साथ भी आज सुना कि उन्होंने इसके बारे में क्या मज़ीद वजाहत की डाइट के बारे में. मैं डॉक्टर शॉन बेकर आपका शुक्रिया, आपने मालूमात को चैलेंज किया और जदीद सेहत के सबसे ज़्यादा गलत समझने वाले शोबे में से एक शोबा यानी ग़िज़ाइयत और कार्निवर्स डाइट पर आपने वजाहत लाई. आपका ज़रूरतमंदाना अंदाज और हकीकी नताइज पर मुश्तमिल तवज्जो वाकई इस बात को नई शक्ल दे रही है और खुराक ताकत और सिर्फ खुराक के ज़रिए दायमी बीमारियों से सेहत याबी के बारे में कैसे सोचते हैं उसके बारे में आपने वजाहत की. आप अपने काम को इसी तरह से ज़ोरों शोर से जारी रखिएगा. आपका शो में आने का आज शुक्रिया. सामीन, अगर इस गुफ्तगू ने आपके लिए नए सवालात को जन्म दिया और आपको किसी तरह से मदद दी तो आप प्लीज़ इस एपिसोड को शेयर करें, सब्सक्राइब करें और इस सच्चाई को तलाश करते रहें कि आपके जिस्म को क्या तवानाई फराहम करती है. अगली बार तक मजबूत रहें, मुस्तैद रहें और अपनी सेहत का चार्ज लेते रहें. मेरी तरफ से स्टूडियोज़ में सबकी तरफ से आपको सलाम. अगली एपिसोड तक अल्लाह हाफिज़.